careers matter, and where they begin is important. So why not build on a solid foundation, one built by innovators, compassionate caregivers, and expert specialists, a foundation built on excellence and experience. The Cardiovascular Fellowship programs at the University of Missouri, Kansas City allow fellows to explore the full spectrum of cardiovascular subspecialties. National and international leaders help make the cardiovascular disease program one of the top 10 in the country. The primary training site is in the heart of the country and cares for the hearts of the world. St. Luke's Hospital of Kansas City. U.S. News & World Report ranks St. Luke's Hospital among the top 25 for cardiology and heart surgery in the nation. Here, opportunities for clinical research place St. Luke's among the most prestigious academic institutions in the country. The expectations are high. The prestige is world-class. And most importantly, we are dedicated to caring for the hearts of our community. The university partners with St. Luke's Hospital and Truman Medical Center to offer diverse care settings and patient populations. Fellows have the opportunity to pursue a multitude of subspecialties and experiences. CICU and clinical cardiology. Fellows at St. Luke's work alongside highly skilled attending cardiologists in the Cardiac Intensive Care Unit and on other consultative services. St. Luke's excellence is defined by multidisciplinary collaboration with many teams, including ECMO, advanced heart failure and transplant, adult congenital heart disease, and surgery, providing patients with leading-edge treatments and impressive outcomes. Interventional cardiology. Cardiology visionary Dr. Jeffrey Hartzler pioneered the first use of PCI in acute MI in 1980. Today, fellows in our program learn from St. Luke's interventional cardiology experts to deliver leading-edge care in interventional cardiology, including complex, high-risk, and indicated PCI CHIP interventions, chronic total occlusions, robotic-assisted PCI, and peripheral vascular interventions. 2 ACGME accredited interventional fellowships are offered each year. Structural interventional cardiology. Fellows have access to advanced training in structural interventional cardiology, including transcatheter aortic valve replacement, transcatheter mitral valve repair and replacement, left atrial appendage closure, ASD PFO closure, among other advanced procedures. St. Luke's faculty are authors and investigators in multiple landmark trials in structural heart disease. The partner trials, COAPT, PROTECT AF, PREVAIL, among others. 1 structural fellowship is offered each year. Echocardiography. Learn the fundamentals and leading-edge echocardiographic methods, including 3D echo, strain, and advanced structural echo. 4 to 5 Echo Board certified cardiologists serve daily as interpreters in one of the busiest echo labs in the Midwest. St. Luke's faculty includes members of the editorial board for the American Society of Echocardiography and are authors of the Society's guidelines. Advanced cardiac imaging. Work with international leaders in advanced CV imaging, including the American Society of Nuclear Cardiology President-elect and former presidents. Fellows get first-hand experience reading FDG PETs, cardiac amyloid scans, cardiac MRI, and cardiac and vascular CT, all performed on cardiac-dedicated devices and interpreted by cardiologists. St. Luke's cardiovascular imaging faculty and fellows have authored several hundred peer-reviewed publications and national guideline documents and have been featured in the New York Times. Advanced heart failure and transplant. Fellows benefit by working at the only nationally ranked top 20 by volume heart transplant center in the Midwest. St. Luke's is proud to be a national leader in heart failure quality and patient outcomes and has been recognized with the American Heart Association's Gold Plus designation. 1 ACGME accredited advanced heart failure and transplant fellowship is offered each year. Cardiac electrophysiology. As a fellow, you'll work closely with EP experts to perform more than 1,300 device implants each year, including leadless pacemakers, His bundle pacemakers, and subcutaneous ICDs. St. Luke's experts also perform more than 700 catheter ablations, including complex ablations for atypical flutter and epicardial ventricular tachycardia. St. Luke's Hospital was one of the first hospitals in the nation to utilize a novel 3D mapping system. St. Luke's conducts groundbreaking research through clinical trials and registries and hosts training courses for cryoablation and phrenic nerve pacemaker implantation. One position for a 2-year ACGME-accredited EP fellowship is offered each year. Preventive Cardiology. Preventive Cardiology Fellows receive training in medical therapy of atherosclerosis and coronary artery disease, including risk assessment, lipidology, exercise physiology, hypertension management, psychosocial screening and behavioral counseling, and design, implementation, and analysis of preventive cardiology research. One Preventive Cardiology Fellowship is offered each year. Cardiovascular Research. Fellows work with faculty mentors and biostatisticians with access to national registries and clinical trial data. St. Luke's faculty publish more than 200 peer-reviewed papers each year and have been recognized by the AHA with Distinguished Scientist and Lifetime Achievement Awards and named as Thomson Reuters' most influential scientific minds, high-site investigators. St. Luke's leads clinical trials, particularly in cardiometabolic disease and new technologies, including the Apple Watch Heartline trial and the ischemia trial. Fellows average more than 15 abstracts and 13 publications in high-impact peer-reviewed journals. Research fellows routinely receive special honors and awards, including Young Investigator Awards, and have entered into academic careers. 2 fellowships are offered each year for an NIH-funded T32 postdoctoral training program, combined with a clinical cardiology fellowship into a 4-year program. Simulation training. Fellows benefit from a state-of-the-art medical simulation center where live training expands hands-on cardiovascular procedural experience and confidence. Simulation is integrated into the curriculum and directly supervised by St. Luke's faculty. The fellowship program also provides an opportunity to earn a master's degree or graduate certificate to support career paths in medical education, business management, and clinical research. Whichever path you choose, we are committed to supporting your professional success. Choose the right direction for you at the University of Missouri, Kansas City School of Medicine. Learn from our nationally recognized program and the legacies of St. Luke's researchers, specialists, and compassionate expert physicians. Together, we can make a difference.